Welcome to the St. Stephen's Community House Crystal Methamphetamine e-learning series. This is Module 1 of 4. Module 1 offers a basic introduction to crystal methamphetamine, what crystal methamphetamine is, how it's taken, and its short and long-term effects. So why are we talking about crystal methamphetamine now?
The Ontario Office of the Chief Coroner tracks deaths associated with crystal methamphetamine use. The table you see shows us that there is a level of death associated with crystal methamphetamine use. Remember that even though deaths are increasing, death is an extreme outcome from using crystal methamphetamine. St. Stephen's Community House has seen an increase of individuals presenting with complex crystal methamphetamine use over the last 2 years that includes specific challenges around paranoia, aggression, and behavioral challenges. These individuals are presenting frequently to emergency rooms at hospital departments and experience restrictions from most services in the city. These individuals are also more likely to be engaged with the justice system. St. Stephen's identified the need for evidence-based training for frontline workers around these specific impacts for crystal methamphetamine. The Canadian Centre for Substance Use and Addiction has recommended to the federal government that they help reduce stigma by promoting substance use as a health issue, increase the availability and accessibility of evidence-informed, client-centered continuum of services and supports, and support interventions specific to crystal meth use. Methamphetamine is part of the amphetamine class of substances, a group of drugs that stimulate the central nervous system. It has been around since 1919. Methamphetamine is available in 3 forms: powder or speed, base, and crystal. It is cheap and relatively easy to access in Toronto. You can buy a bag which is around 0.3 grams for $50 to $60. Crystal is the focus for these modules as it is a more potent form of the substance and can have the most intense effects. Names for crystal methamphetamine include crystal, tina, tea, glass, tweak, crank, ice, and jib.
Ways of taking crystal methamphetamine. Crystal meth can be taken in several different ways. How it's taken makes a difference in how long the effects last and how immediate the effects are felt. Safe crystal meth smoking kits are available with a Pyrex bowl pipe, mouthpieces, and alcohol swabs. The glass pipes available in stores are prone to shatter when heated and pose a risk. Hot railing, which is when crystal meth vapor is inhaled through the nose, is best if people use their own stems or have neti pots to use, as opposed to sharing. Your organization may decide to have smoking kits, stems, and neti pots on hand from a harm reduction standpoint. They're available locally at the works and supervised consumption sites. You can go to the link you see on your screen to see a list of overdose prevention sites and supervised consumption sites in Toronto. The impacts of crystal meth on cognitive functioning. It is not a guarantee that a user of crystal meth will damage their brain to an irreversible degree. It is also not shown in the research that a user of crystal meth will automatically experience psychosis. Misinformation in the media supports that false idea, and it is rooted in stigma. There are a range of impacts on people over the longer term, depending on why and how they use. Crystal meth, in certain amounts, has been shown in studies to have a similar effect to drugs used to treat ADHD, like Ritalin. Let's take a look at some of the immediate effects of using crystal methamphetamine. All drugs have an immediate effect, and crystal meth is no exception. In fact, crystal meth is higher in purity generally than other forms of methamphetamines, and so the effect is more intense. People using crystal meth generally report a rush or a high that can last from 30 minutes up to 6 hours, depending on the dosage and method of consumption. This is longer than other drugs like crack or cocaine, which may make it appealing to some people. Crystal meth also releases more dopamine in the brain than other drugs like cocaine or nicotine. Dopamine is the chemical in our brains responsible for producing feelings of pleasure when we engage in acts that help us survive, like eating or having sex. It's also responsible for feelings of euphoria when people use crystal meth. Since our brains learn to repeat what feels good, it makes sense that the intense feelings of pleasure created by crystal meth reinforce that very behavior. Of course, crystal meth gives you that initial high. Those effects are more or less intense depending on the amount of crystal meth taken, how it's taken, the tolerance of the user, the last time it was used, and the existing physical and mental health of the user. Everyone is different. The use of crystal meth increases several aspects of your body's functioning, including alertness, energy, suppressed appetite, and self-confidence/feeling good. Other immediate effects can be seen here.
For some, crystal meth serves as a functional substance. For example, the increase in alertness crystal meth offers may give a greater sense of safety and an ability to stay awake at night, especially for those sleeping rough. It can provide distraction or relief from the impact of trauma and daily experiences of oppression. It can help people to focus, and for some who have used for a long time, can support the basic capacity to function. It can help people to feel good and have a sense of confidence.
There are some harmful effects of crystal methamphetamine use as well. The list below gives some examples. Again, these effects depend on several variables as described earlier. When you are interacting with someone who is using crystal methamphetamine, you may see and experience certain things. Your job is to provide support. Here are some things you may see. If people feel overheated, it may lead to clothes being taken off or being really thirsty. This isn't a behavioral issue, it's the effect of the drug. You can make sure they have access to water and offer safe ways to cool down, like offering an ice pack in a towel. People who take other medicines or use other substances may get additional stimulation. This includes taking extra crystal methamphetamine, crack, or drugs like Ritalin or certain antipsychotics. Smokers might use more cigarettes. It can be hard for people to remember to take pills with extreme cases of using crystal methamphetamine. Imagine if half a day goes by in half an hour, for several days at a time. You can get to know someone's prescription regime and support them with reminders to take their medicines on time, or go to the pharmacy with someone to get their daily doses.
A word about meth mouth. Meth mouth is a pervasive stereotype related to users of crystal meth. It is not a given that a user of crystal meth will develop oral and dental issues, but crystal meth can speed up natural decay of teeth and also cause dehydration. Those who do develop dental and/or oral health issues do so most often because they are living in poverty. They don't have access to healthy food and struggle to get access to regular, good quality dental care due to system barriers. Risk reduction. What can you do as a worker if someone asks for your support in terms of their crystal meth use? Ask what people need. Support people too. Plan ahead for their use as much as they want to or can. Think through what method of use they prefer and why. Support people not to share equipment or not to mix with other drugs. Support plans around eating and drinking water and sleep. Go with people to their pharmacist or doctor to talk about prescription interactions.
We are grateful to the Toronto Central LHIN and University Health Network for funding this project.